In recent months, the drug, Manjaro, has taken social media by storm, being hailed as a miraculous solution for rapid weight loss. Celebrities, influencers, and even everyday users have shared testimonials and transformation photos online, creating a viral sensation around this injectable medication. However, beneath the glossy images and dramatic before and after videos lies a darker reality, one that medical professionals are increasingly alarmed about. Doctors and health authorities around the world, particularly in Asia, are issuing strong warnings about the off-label use of Manjaro for cosmetic weight loss. Originally developed to treat type 2 diabetes, the drug has been repurposed by non-medical users for shedding pounds, often without proper medical supervision. In China, where demand has exploded, reports are surfacing of the drug being resold at exorbitant prices on the black market, fueling both economic and health concerns. What is Manjaro? Manjaro, also known by its generic name tirzepatide, is a relatively new drug approved by the U.S. Food and Drug Administration (FDA) for the treatment of type 2 diabetes. It works by mimicking the action of two hormones, GLP-1 glucagon-like peptide-1 and GIP glucose-dependent insulinotropic polypeptide, which help regulate blood sugar levels and induce a sense of fullness. Because of these effects, patients often experience weight loss as a side benefit. However, the unintended weight loss effects have become the main attraction for non-diabetic users seeking to slim down quickly, leading to a surge in off-label prescriptions and unsupervised self-injections. The role of social media in spreading the craze. The popularity of Manjaro for weight loss has been significantly amplified by platforms like TikTok, Instagram, and Xiaohongshu, China's lifestyle app similar to Instagram. Influencers showcase their dramatic weight loss transformations, attributing their success to weekly Manjaro injections. The use of catchy hashtags such as #Manjaro weight loss and #SlimShot has made the drug trend globally. Celebrities rumored to use the injection have further fueled the frenzy, despite a lack of medical endorsement. This social media-fueled hype has led to a dangerous misconception, that Manjaro is a safe, quick fix for obesity or even mild weight gain. Health professionals warn this is far from the truth. Medical community sounds the alarm. Doctors in Japan, China, and South Korea are increasingly speaking out about the potential dangers of misusing Manjaro. Dr. Jun Saito, an endocrinologist at a major Tokyo hospital, emphasized, tirzepatide is a powerful drug designed for people with serious metabolic conditions. Using it solely for cosmetic weight loss, especially without supervision, is irresponsible and can be life-threatening. Common side effects include nausea, vomiting, diarrhea, and loss of appetite, but in some cases, the consequences are far more serious. There have been reports of pancreatitis, severe dehydration, gallbladder issues, and even suicidal ideation among users misusing the drug. Doctors are particularly concerned about people with normal weight or minor obesity using Manjaro unnecessarily, thereby disrupting their metabolic balance. Alarming trend in China. Black market and high prices. In China, the situation has escalated to alarming levels. With official supplies limited and prescriptions closely monitored, an underground market has developed. Black market dealers are reselling Manjaro at prices up to 10 times higher than the retail value, with a single injection costing up to 5,000 yuan, about $700 USD. Many buyers turn to online platforms and private WeChat groups where individuals offer vials of the drug without medical consultation. These unregulated products pose additional risks, including counterfeit drugs, improper storage, and incorrect dosing. One 26-year-old woman from Shanghai, who spoke under anonymity, said, "I bought it from a friend's connection. I lost 10 kilograms in 2 months, but I often felt dizzy and once fainted at work. Now I regret it, but it's hard to stop. I'm afraid of gaining weight again." This psychological dependency and pressure to maintain an unrealistic body image are deepening concerns among public health officials. Global pharmaceutical ethics under scrutiny. The Manjaro phenomenon is also reigniting debates around the ethical responsibilities of pharmaceutical companies. While the manufacturer of tirzepatide has marketed the drug primarily for diabetes and is undergoing clinical trials for its use in treating obesity, critics argue that insufficient safeguards are in place to prevent off-label abuse. With the drug becoming a trending name, doctors are calling for stricter controls over distribution and prescription practices. In the U.S., some physicians have begun refusing to prescribe Manjaro for non-diabetic patients unless they are clinically obese and have failed to lose weight through traditional methods. China's health authorities are now investigating the illegal resale of the drug and planning enforcement actions against counterfeit networks. Meanwhile, Japan's Ministry of Health is considering updated guidelines to prevent unauthorized use of diabetes medications. The psychological toll and societal pressure. Beyond physical health concerns, the psychological effects of the Manjaro trend are also significant. The glorification of thinness on social media platforms has intensified feelings of inadequacy, especially among young women. Mental health experts warn that easy access to powerful weight loss drugs could worsen eating disorders like anorexia and bulimia. Moreover, the normalization of chemical weight control undermines the importance of healthy diets, exercise, and sustainable habits. Professor Lin Xiaomei, a clinical psychologist at a Beijing university, says, "This is not just about a drug, it's about a mindset. If society continues to value slimness over health, people will keep taking risks." Calls for stronger regulation and education. Experts agree that stronger policies and public education campaigns are urgently needed. They recommend 1. Mandatory consultation with a licensed physician before receiving any weight-related prescription. 2. Strict penalties for unauthorized sale or resale of prescription medications. 3. Public health campaigns to highlight the dangers of off-label drug use. 4. Better social media moderation to combat misinformation and glorification of risky health practices. Authorities in China have already begun cracking down on illegal sellers, while Japan and Korea are increasing medical audits to prevent unethical prescription.